Thanks for remaining with us. Now talking health under the Buhari administration. Now the universal health coverage and the revamping of 10,000 primary health care delivery centers across the country are just a few of the highlighted commitments made by the federal government to improve on Nigeria's ailing and crippling health sector.
Now, as we look into the past 2 years of Nigeria healthcare sector, TVC's Kemi Balogun explores these issues and more.
Emphasis had been placed by this administration on improving the healthcare of the most vulnerable and the poorest of poor with the Rapid Result Initiative. The RRI is targeted at responding to the critical needs of people with a visible impact on improving healthcare insurance, surgical interventions, and also the treatment of 200,000 severely malnourished children with the emergency feeding program in the Northeast. It has earned the Minister of Health, Professor Isaac Adewale, a lot of applause in some quarters for putting in place policies and bringing to bear strategies that are expected to improve healthcare of Nigerians. But others believe the targets have not been met.
We want a health system that will serve Nigerians, and this is our vision for the health sector.
The federal government had also made plans to curb and reduce out-of-pocket expenses for individuals with the introduction of the Universal Healthcare Coverage Plan. But presently, Nigerians still spend about 70% of their earnings to get adequate healthcare service.
Everybody is complaining. You get to hospital, even government-owned hospital. Certain drugs that you should be able to get easily, they will tell you you have to go out and purchase them.
Most people in the country, because of the prevailing diseases and sicknesses all around, I think they spend more on healthcare services.
The revitalization of 10,000 primary healthcare centers for the improvement of public health is also on the list, but the realities on ground are a far cry from the words spoken or written down on print. The idea is to make the primary healthcare centers at the top of the chain using an inverted pyramid in order to make healthcare accessible, thereby cutting down on demand for tertiary healthcare services. Mixed feelings rate the performance of the health sector, and advocates believe a lot more is needed.
What drives health is not just the availability of the hospital, but the availability of the resources. Resources could be material resources, financial resources, human resources, as well as mental resources, cultural resources. So all of them have to drive together so you can get good health.
Healthcare financing remains a big issue. Professionals insist there is need to improve on that for the health sector. Under the Better Life for All program, the federal government recently highlighted its achievements of having carried out more than 4,000 surgeries and 17,000 health screenings. But the prospects of having a functioning and vibrant healthcare system is a long way from being achieved. Kemi Balogun, TVC News, Abuja.
Right, that gives you the background to what we're talking about this morning. But we're joined now by a medical doctor, Dr. Adedeji. It's good to have you join us right now.
Thank you very much.
Thank you so much.
Thank you. Right. So good to be here.
Yeah, let's look. If we sit down here now and look back 2 years when this administration started, there were lots and lots and lots of promises made, and Nigerians had lots of hopes as to how things were going to go well. And if we narrow it down to the health sector, one area was primary health care. If we start from there, between that time and now, how good or well off is the primary health care system in the country right now?
Quite honestly with you, nothing much has changed in terms of results for what's been done. And I think a lot more can be done, believe me. If we can get serious in this country from just the position of postulation and then executing what we promise, it's possible. You know why I'm worried about this is that, quite incidentally, I was part of the team of the SURE-P. I was involved for about 3 years. The promises were made that we will restructure, revamp the primary health. And I do tell you, if that is done critically well, most of the things we're seeing will not be necessary, because I think in this country, offering to the vulnerable is very important as much as preventive medicine. Most of the things that we're talking about doing surgery are curative. they are top of the line issues. How many people will need surgery? People will need basic things like going to hospital, like the gentleman said. Getting the basic, getting basic drugs that you can treat malaria, you can go to a health center, you can be treated and be satisfied with the level of treatment available. When you cannot, then you move to another center. But as long as we're still struggling with that and struggling with diagnosis, it will be a major issue. So for me, I think the government is settling down. I'm not saying anything has been done. Professor Adewale is a very intelligent medical doctor of a repute. I mean, he was VC, he was in medicine in Ibadan. So we know. But you see, the thing that I think in this one that is wrong with us is, how do we as the people, I heard you talking to Ezekwere or whatever, the man from Abuja, is a synergy between the ordinary Nigerian with government and then moving it into execution. Everybody has lost faith. What is important to everybody is what is the need for me right now. We can't succeed with that.
And of course, you just pointed to the fact that Isaac Adewale is a very brilliant medical doctor.
Absolutely.
He is obviously a round peg
in
a round hole.
Yeah.
So why is it that over the years down the line, long before this administration came on board, we've hardly paid much attention to health? Of course, the minimum of 15% of total budget for health, we've never reached anywhere near that.
You see, let me tell you something that's always been glaring in this country is the issue of self-interest. Honestly, if we're serious people, we either should have a unicamera instead of the bicamera that we have. I don't, look, for me, people say I'm hard on this, and I'm hard on it as well for reasons. From what I have seen in this country, so we don't need the Senate. They waste on our resources. Look, if we people get serious about the things we do, how much do we need to pay a legislator if he says he believes in this country and he wants to work for this country? Every one of them in that place, House or Senate, ran only on the apron strings of Buhari has changed. They don't believe in his change. That is why we're saying what we're saying. If there's is the
Senate really what Nigeria's problem is, or the fact that the attention that should be paid to the vital sectors of the economy?
No. I just use that as an example. They're not really a problem, but they're part of the problem. There's a committee in Senate on health. What is their direction? What has been their impact in legislative matters concerning health? You see, over the years, we have paid lip service to 15% for health. But that's the way we do in Nigeria. We pay lip service to serious things and then run after. Because if we give the money, look, the other thing you must look at, I've worked in teaching hospital before, and I worked in private sector. Now, I left in private sector. The amount of money to the health department can do good things if people are not corrupt. There's a chain of corruption along the line. You want to buy stuff into the teaching hospital. I remember one particular time, I won't forget, when I was in Ife. You want to buy syringes and needle. The administrator said, why don't you buy the syringes first? How do you use syringes without needles?
Exactly.
So it's a concept, it's an individual thing. People just come into a place, there is no vision. A man comes into a job. What is his legacy? What does he want to leave behind as what I have done? But you find that in the Ministry of Health, even if the minister wants to do magic, he needs people to do his magic. How many of the people believe in what he wants to do that are working with him? We had Ebola, we had all kinds of things coming to Nigeria. Is there anybody sitting down and creating an epidemiological survey of this country, of the things that can happen? Where's a vaccine? If something happens and we begin to run, we go and look more for money to buy vaccine for that particular situation.
Like we saw during the meningitis.
Absolutely. Exactly. Been waiting for vaccines for so many.
I can tell you there was a time, I keep saying this. I know Professor Nasidi because we interacted when he was head of the virology department and he was in charge of vaccine. Vaccine was not a problem about 15, 20 years ago in this country. And then they needed to be taken to Oshodi or something. Why is it that today we don't have a vaccine laboratory in Nigeria? Why is it today that we don't have a laboratory of consequence that people can send specimen from anywhere in West Africa at least? We send specimen to South Africa. We said that certain things we can't do, we do in Ghana. It's a shame.
Well, that's really touching, but let's go on a break and then we will come back to dwell more on this. Stay with us on TVC Breakfast. We're discussing the health sector in Nigeria, and we're looking at the past 1 year or maybe even 2 years of the current administration in Nigeria. Stay with us. Right, thanks for staying with us on TVC Breakfast. We're discussing, laying our focus on the health sector in the past 2 years of this administration. We're taking a look. We have with us in the studio Dr. Dokun Adedeji. We've been talking about this, and we also expect another guest to join us from our Abuja studio. Now, we had about a few days ago, we had in this studio, we discussed issues in Lagos University Teaching Hospital. And union members and some medical doctors were talking about the fact that even there are no gloves, hand gloves for ordinary activity you're supposed to carry out. The whole place is messed up and all of that. But if we have to put this together, is it really the problem of the government on one hand, or even the hospitals themselves that are not pulling their weight enough?
You know, I can tell, like I said to you, is a chain. Certain money is budgeted. Sometimes that budget never reaches the sources that should use them. If you then go to hospital, it again depends on management. But I can tell you something for Luth. I think the provost, we used to be classmates, so I know she's very good, Professor Shadima Boguja. And then I think the medical director is Chris Bode. I know those two very well. Impeccable integrity, and I am sure that if something, look, the medical director can say this should be done. It depends on he is not going to buy those things. But I still take this thing back to all of us as a people. What is our expectation of Luth? As a patient, when we go there, when do we complain? We complain only when it happens to us. The moment our own case is dealt with, everybody walks away. There should be minimum that is expected of a teaching hospital. You understand? If we don't do that, and I think the NMA also should get serious about this. I say I should belong to NMA. The thing is, everybody faces frustration and then we walk away. Oh, it can't be done. It can be done. It depends on the level of diligent pursuit of what we want. Nigeria will not change overnight because we wish it. We have to work for it to happen. Well,
exactly what the acting president said in his Democracy Day speech. Now, when you look at the budget for health in 2017, about 304 billion or so, and then you hear that there are plans to revitalize nearly 10,000 primary health care centers and all of that, and so many other demands under health. You wonder if this budget would actually meet these requirements in the health sector. All right, continuing our discussion on health under this administration in the last 2 years, our guest is Dokun Adedeji, who is a medical doctor himself. Now, the question I was asking earlier, the budget for health, 304 billion for public health, and then there's a plan for primary health care centers in at least one in every political ward. That's what the health ministry is telling us. Now, this is only one requirement in health. This budget...
let me be very honest. Yes. There's no time the budget will be adequate. No time. The important thing is to make judicious use of what you have, and then people should sit down and prioritize. In the context of where we are and where we're going, how should the steps be? You see, I want all of us to know something, including the government. We can't overnight jump and then become what we want. There must be a systematic way of attaining the goals we want to attain. If we say that, then we'll be running ourselves to a loss. And then you get to a point where you say to yourself, did we achieve? If we're going to spend 304 billion, and then you look at it, you need 10,000, can you do 10,000 in a year? Would you like, where are the most vulnerable areas of the 10,000? Would you like to do that? And it's obvious. And then you have indicators, parameters to measure how those have impacted on the things that you're trying to contain. That is the way to work. There will be no time that we will have adequate. There's no man in his house has enough money to spend every month.
Yes.
But you prioritize.
And compartmentalize.
And compartmentalize it, and then you work towards it. Let us not walk ourselves into failure by the things we promise.
All right, let's bring in our Abuja guest, the CEO, EPI Africa, the Health Communication Advisor for Nigeria Health Watch, Ifeanyi Nsofo. Ifeanyi, it's good to have you join us right now. Let me take you from the plan by the federal government to build about 10,000 primary health care. We remember the days of, or the years of Professor Oluke Ransom Kuti. The local governments were in charge of primary health care, but now we see that the federal government is taking this up. This is not the misplacement of priorities?
Yeah, good morning, and thank you for having me. I think that the plan by the federal government to rehabilitate primary health care, but let's also not forget that Nigeria is actually decentralized. So in principle, the federal government, oversees tertiary health care as well as regulating health agencies, federal health agencies within the hospitals, special medical centers, and all that. State governments are in charge of secondary care, and primary health care is still under the purview of primary health care of local government councils. So I'm aware that the federal government is doing this in partnership with states as well as the primary health care councils. But at the end of the day, we really don't think, for us at Nigeria Health Watch, we don't think that's a solution. That's not all the solution to the problem. At the global level, even the new Director General of WHO has said that the focus is on universal health coverage. And the basic definition of universal health coverage is people having access to the care they need when they need this care without suffering financial hardships. And you agree with me that that's not the way it is in Nigeria. And a lot of people, still have to pay so much out of pocket for their health care. So even in Professor Adewale trying to bring some science in the system in rehabilitating health centers, we feel that there should be a concerted effort by the federal government to ensure that Nigerians have access to universal health coverage. And one very easy way to do that is providing health insurance to Nigerians.
Okay, of course, I was going to ask you exactly how Nigeria can achieve universal health care coverage. And you just pointed out one, healthcare insurance for all. We do hear that the National Assembly is planning that NHS should be available for everyone, and they're going to be passing a bill. Hopefully that will happen soon. But my question again is private sector participation. Is that going to be a way out of the poor healthcare delivery system that we have in Nigeria?
Okay, well, I think yes to that to an extent, but also remember that when we're talking about universal health coverage, we're talking about care that is accessible, that is affordable, and it's also equitable. And you know that if you're talking about private sector, most of the time people are more profit-oriented. So, and that's why health insurance ensures that there's a buy-in by different people, the community, the people who pay for health, the government, as well as the private sector, to ensure that the weakest and the poorest amongst us also have access to care, even as we're planning to bring in maybe partnership to ensure that access to healthcare improves. So let me give you an example. There's something called the National Health Account that is done periodically in Nigeria. And what it does is that it looks at the total health expenditure.
All right, it seems we have lost the audio from Ifeanyi Nsofo from Abuja. We'll maybe like to have him back on if we can work that out. Now, let's get to the issue of, it is one thing to access health. It's another thing to access quality health. We have seen, exactly, we've seen under where you have the insurance, for those who have insurance coverage. Sometimes you go under insurance, you don't have access to quality health care.
You see, this comes back to the same way we were saying. we need to sit down in this country and understand concepts that we want to practice. What are the components of the concept? What should be the prerequisites before you start? It's nice for Senate to say, oh, we pass this. What do we have in place? How does this, how do we, the things we have in place key into this, and what do we need to have to make those things work? Before I left private practice, my company had gone into HMOs. I kept them a long time from going to HMO because I know how these things work. You say for malaria, we pay you 40 naira for the treatment. And the man looks for the cheapest of drugs. And then they give you the drugs that you keep going back. And quality becomes it. Who defines the quality?
Exactly.
Who checks the quality? If, for instance, somebody goes in my local government to go and access health, what are the things that he must have as a necessity? If we do not have those things compartmentalized and everybody and standardized, everybody knows, we'll just be deceiving ourselves. We'll just build the things. You see, the thing is not just having the health centers. What about the resources? What about the management of those places? What about the infrastructure? You see, that's why in this country, we must, when we budget for health, it is not solely health. Health must sit down with water, sit down with other means to say, how do we work together? You don't provide good water, good housing, and then you provide health. And the man has diarrhea and has diarrhea. So what's the essence of expending when there could be preventive by working together to create an infrastructure that supplies that?
It's okay. Wow, so much to look into.
Thank you so much. That means, of course, we can't even begin to talk about referral system when the fundamentals are not even in place. Thank you so much for your input. Of course, Ifeanyi and so forth, CEO, Epi Africa Health Communications Advisor, joined us from Abuja. Unfortunately, audio problems cropped up. Thank you, gentlemen.